The military expenditure is one of the expenditures. I think we are here in the conference where it goes on health, and I think in terms of comparing notes, it is essential to put the military expenditure, health, education, and other social expenditures together in order to come to conclusion. And what we have done, and that is the next 10 minutes, the issue which I would like to explore on is the Global Militarization Index. What we have done here, that we have compared 150 countries, and the overview of funds made available by the state to the military in relation to other economic and societal factors. You will get also later on this map where the countries are mentioned and the figures also and the expenditures on military and on health. Reliable data we got are from very solid and international renowned sources such as CPRI, others for the military expenditure, WHO for the health, UN also. So we gathered the data, and this index actually is non-normative. So we don't say because it's high military expenditure it's dangerous, or it is actually leading immediately to a conflict, but you will see some of the conclusions which I will come to. So this is the map which I will present to you after this, hand out to you after this presentation, where we have various countries, gathered 150 countries altogether, and have elaborated a ranking. As I said, this militarization, as we have it here, refers only to the amount of resources the state provides to the military. The more militarized the country, the more resources are actually bound or are devoted to the sector, actually in comparison with the others. I will come to some examples, concrete examples, at the next stage. So there are already, when the list is from 1 to 150, there is a high militarization, for instance, Bulgaria number 16, and Greece and number 17, Finland number 14. So militarization always the funds and relation to others. But I think you could not necessarily conclude that Finland, because of this relatively high militarization, is considered an aggressive country. This means, as a conclusion actually, that this global militarization index does not understand militarization as, how should I say, a warmongering, but rather objectively the relative importance the country allocates to military. What are the state resources for the military budget? First of all, definitely it is a budget as such, it's a figure. I think every country has, we in Germany now have the budget discussion for the year 2010, so it's an allocation of funds, a certain amount of money. But then definitely that's not enough, only the allocation, but also in order to measure it completely, we also included personnel, so soldiers in armed forces, state paramilitaries, and reserve forces, which definitely also form a force within the military. And one element which is sometimes overlooked in these indexes is the conventional weapon system, which are armored vehicles, artillery, and other heavy weapon systems. So it's this global militarization index, exactly relation of military issues to others, is the budget in relation to the gross domestic product and government expenditures, as we have done it here in this particular case in all the 150 countries on health services. So that's one. But then also, as I said, the second, personnel, military and paramilitary forces in relation to the total population. An index always has a relation between various variables, so that's the second one. Reserve forces in relation to the total population, and military and paramilitary forces in relation to the number of physicians in the country. The third is the heavy conventional weapons in relation to the total population. And here is, this would not go without weighing factors. So we have the three areas, and I repeat, there is a first, the category is the expenditure, how much money goes in there. The second is the personnel, the index, and the third are the arms. So these are three categories, and the indicator, as I have mentioned here, in terms of the budget or the expenditure, it's the military spending as percentage of GDP. The military spending in relation to health spending. Military, I spent this for military, I spent this for health. So this we considered quite high in this index. In personnel, it's military and paramilitary personnel in relation to population. Then also military reserves in relation to population, and the military and paramilitary personnel in relation to physicians, in order to have this relation. And the third category in arms, heavy weapons in relation to population. Let me, as I promised you, give you some ideas on these examples. For instance, Nigeria was also yesterday discussed, and what is there was mentioned by IME yesterday. It's apparently the Niger Delta up in flames, or the oil fields up in flames. So you have an idea about the conflict there. But the example in Nigeria shows what I said earlier on. It does not necessarily mean the higher the militarization, or the lower, the more the conflict, or the less conflictual. So the example in Nigeria is only amongst 150, is only 145 on the GMI, one of the least militarized countries. Military expenditure has this amount, as you can see it, 825 million, and the GDP, so I have listed all the indicators there. The health expenditure as share of the GDP is 3.9, and heavy weapons systems valued with this 1,370. At the same time, and as most of you are aware, that armed conflicts between Christians and Muslims, also nothing new based on the discussion we had yesterday, the regional and local clashes around political power, and some research being done on this. This means, again, and I repeat it, I think it's important to know that a low degree in militarization does not mean per se that the situation for the population is actually peaceful or secure. And here the GMI advises a country analysis with regard to security governance. So then another one, which is relatively high, it's number one on the GMI, the most militarized country in relation again to the health comparison. Military expenditure very high, and heavy weapon systems equally, so that's why they managed to get on number one in this index. I think what instruments we want: global disarmament, transparency, or a tool for confidence building. So capacity building was one issue which I've mentioned in order to get to the knowledge and also to have the figures present. And don't let me go into the detail. And I would like to conclude with this, and thank you, and I will distribute now so that you have also something in your hands on the militarization index which we have developed, which hopefully can be a tool in the discussion between health and also military. Thank you so very much.